Hi, my name is Dr. Holt, and I'm a certified trauma expert, and I specialize in different levels of trauma, specifically from early childhood trauma, and then the different types of trauma as far as acute trauma, chronic trauma, complex trauma, post-traumatic stress disorder, trauma 1, trauma 2, developmental trauma. And the fact of the matter is we're seeing more children that are struggling with high exposure to trauma than we've ever seen before. Those traumas can look like poverty, look like violence, community violence, domestic violence, maltreatment, neglect, abuse. Fact of the matter is kids are really having a hard time because of their exposure of trauma. And so today we're going to be talking about, in this video clip, the different types of trauma, defining what trauma is, and defining what the stress that comes with it. So tune in, listen in, and let me know what you think.
Yo, check it out. My name is Dr. Holt, and I'm a certified traumatologist, as well as a mental health specialist, another trauma crisis specialist, trauma practitioner, and restorative practice license trainer. And pretty much when we talk about a lot of the needs of children in early childhood education and K-12 education, what kids need is a lot of social emotional support. And I know you've had to ask the question, why do we see so many chronic and systemic issues in our school system, especially in regards to the education of our kids. And we've poured millions upon millions of dollars of trying to correct academic learning, and also to address our discipline and our suspension issues that we see among kids. We are throwing millions of dollars in initiatives and programs, and don't get me wrong, some great programs, but programs such as tutoring programs, such as mediation, conflict resolution, PBIS, restorative approaches, and all these things. And on top of that, we are seeing even teachers today are being severely impacted by their work because we're just even seeing high levels of burnout and compassion fatigue among educators. And so you have to start asking the question, what in the world is going on in our educational system? And I'll tell you what it is. It's a T word called trauma. Trauma have been so systemic in our educational system that if we don't get a hold of it, if we don't really address it, if we don't really put plans in place and support systems in place, trauma is going to erode our educational system. Right now, 70% of Americans, period, have experienced an early childhood traumatic experience or traumatic stress. 90% of those that have psychiatric issues or mental health issues, a lot of it comes from trauma, okay? And we already know 1 in 5 Americans have mental health issues. And so therefore, when we put all these things together, our education system has really been strained because of trauma. Now, a new thing we've seen is also called STS, which stands for secondary traumatic stress. And that's usually caregivers, professionals who works in high levels of trauma are now being heavily impacted by the work that they're trying to support, okay? And this is where we look at compassion fatigue, where educators and professionals are being just drained by the work of trauma. And so we have to look into best practices on how we address trauma, because trauma is really a serious thing. So we have so many children who have been exposed to high levels of trauma. Let's look at trauma. What is trauma, Dr. Holt? I'm glad you asked. Trauma is what we would look at as a emotional or psychological scar or wound that has happened to the individual, and the hippocampus of your brain timestamps that in your memory, and it remembers when you've been hurt and when you've been scarred. And so therefore you have triggers, and you have times where you are under high alert, which we call fight or flight. And so it's a bit of a complex situation, and there's no simple answers. But the big thing is that we're seeing more kids entering into the public population of school, and they have been scarred, and they're constantly living in a high level of toxic stress or chronic stress, which we call trauma, which impacts the brain of kids. And kids are not learning because they're stupid. Kids are not learning because they cannot obtain or retain information. Are you kidding me? Kids are very, very smart. However, when kids have been exposed to high levels of chronic stress and have been exposed to high levels of trauma, it impacts the brain of kids. And if it impacts brains of kids, two major areas it's going to affect. It's going to affect their behavior, and it's going to affect how they learn their academics. And if your cognitive capacities have been compromised because your brain is hurting because of the high levels of exposure of trauma, of course it's going to hurt you. Are you kidding me? When we look at trauma, let's look at it a little bit even more. Trauma, as we said, is an emotional or psychological wound. You've been wounded because of a life-altering situation that has transpired in your life. Yes. The second thing I want to talk about trauma as we defined it is it's also a stress. So it's not just a wound or a scar. Trauma is a chronic systemic stress. Now, when we look at it from a stress, we define it as a stress that supersedes your ability to cope with it. So when a life-altering situation has happened in your life and you're struggling to cope with it, that's not normal stress. Your brain is releasing high levels of cortisol into the body. And we also understand that when too much cortisol and stimuli is released into the body, physiologically it also impacts you and it makes you sick. Okay, so trauma is really, really big. We'll talk about it more, but if you're really, really interested, keep it locked and continue to keep tuning in. And as we talk about how trauma or traumatic stress impacts the individual, Frederick Douglass was really smart and very clever when he said it's far easier to build strong children than to repair broken men. And that is the fact, is that most of the work we're doing on the reactive side of trying to repair broken adults come from the early childhood traumas of when people were young. And in a lot of our families, especially in communities of color, when a lot of traumas in our families, we create family secrets. And so we don't allow people who's been wounded and scarred to talk about or to address their pain. When we talk about trauma, we also talk about types of trauma, right? We talk about acute trauma, stress. We talk about acute trauma, chronic trauma, complex trauma, developmental trauma, trauma 1, trauma 2, post-traumatic stress disorder. Now there's a new type of trauma or post-traumatic stress disorder, also called CPTSD, which stands for complex post-traumatic stress disorder, even though it has not been approved in the DSM-5 to actually have a real diagnosis and classification. But what a lot of mental health professionals are seeing is this new classification that's a little bit more complex. So we will get more into talking about how people are living in trauma, and more importantly, what do we do to create healing, to bounce back from our trauma. So keep it locked with us as we continue to talk about these different traumas in our next clips. But reach me at Higher Ground Dr. Holt at my YouTube channel, Higher Ground with Dr. Holt. And we'll be talking about all these different types of traumas. And we got a lot of time to be talking about it. A lot of schools are closed anyway. So let's get down into the ugly and the dirty so that we can create healing for the individual. Again, keep it locked. This is Dr. Holt for Higher Ground.